I just want to begin by thanking all of you for being here. Before we finish, your presentations will have reached a very wide audience. We have the individuals here today, obviously. It's being recorded. We'll be sending out for permissions to use the recordings for posting it, your talks on various websites. And we also will use the journal as a platform to reference what your talks concern. So the bottom line is, when we're finished, you will have reached a very wide, diverse audience of healthcare professionals, both here in the United States and globally. So I really want to thank you for being here in the middle of the holiday season. I know how difficult it's been. There are two people I absolutely have to thank, and that's Alice, who has been putting all the electrons together and getting the wires connected so we'd all be here. The second person I really wanted to thank was Ruth Steinbrecher, who really tackled the CME and nursing continuing credits and was able to get the package in and the approval. Unfortunately, the approval only came a couple of days ago, but we did get it, and I want to thank Ruth and I want to thank Alice. So the one thing as we go through the day, we absolutely have to have time discipline. We have a tremendous number of speakers and we want to be fair to everybody. We'll try and on the screen, they'll be posted when you're down to, however many minutes you have left. And please, when you get down to a minute or zero, at that point, we need to cut it. And as far as introductions go, we have the agenda with people's mini bios, and that will suffice for most of the introduction. We'll give a very, very brief introduction at the time when that individual goes on. So at this point, I want to use my remaining time. Alice, would you put the slide up? We have been trying to plan this particular meeting for a long time now. We've always held our annual meeting normally in the summer or in the fall. Obviously, with COVID, everything got turned upside down, but we still wanted to have our annual meeting. And that's one of the reasons we ended up here in December. We very much wanted to avoid an all virtual meeting. We wanted to have a hybrid meeting, but the world situation and COVID being what it was, it became clear that we would have to take an all virtual format. Then the second part in terms of determining the meeting was the theme of the meeting. Obviously, disaster medicine and public health preparedness cover a very, very broad range. And also for those of us in the field, this is just a simple graphic representation of the frequency of different types of natural disasters over the last 50 years or so. And as anybody can see, the course has been upward. If you look at a severity index, you'll also find not only are we having more frequent disasters, we are also experiencing more severe ones, and the outcomes in terms of morbidity and mortality and economic loss is quite significant and much higher than it used to be. And the other thing we really wanted to stress in this particular slide was not only how disasters were increasing, but if you look at what the impacts of climate change are, especially in terms of water, whether it's too much or too little, you'll see that the amount of flooding and extreme weather are the two categories that have really caused the greatest increase. Because of all of these things making the work of disaster medicine that much more difficult, we decided to look at the interactions between multiple disasters and climate change. Now, that's a very, very large task, and it's going to involve a lot of work going forward. So the theme of this meeting, and I think the direction of where our society and journal will be going in the future, is looking at how we better prepare healthcare professionals, not only in their discipline, but also they need to be prepared to be responders. Whether they're straight volunteers or not, it's probably not going to matter, because if you're caught in the middle of a disaster or one of these major events, you really don't have much choice but to be a disaster. So I think we, the senior people, really have an obligation to ensure that the education and training of our workforce entails giving them the skills to go forward. When I first got involved with this at the AMA 10, 15, 20 years ago, I guess at this point, one of the things we constantly pressed was every physician has a secondary specialty, and that specialty is disaster medicine and public health. Since then, obviously, our thinking has evolved, and it's not just every physician, it's every healthcare professional. And they need to be talented, not only in their own discipline, but to be able to cross disciplines. Because when one of these events happens, we don't know what's going to be required. In the end, we need to train our people individually and collectively to minimize the human cost of disasters in an ever more hostile geophysical environment. That's a large body of work that needs to be accomplished. And one of the objectives we have is to do it in a way that's science-based, data-based, objective, and hopefully logically applied. So with that, and as our first foray into this, we wanted to present a broad overview of what's entailed in the interaction and intersection of disaster medicine, public health, with climate change and health. And I think we've got a set of speakers that are absolutely world-class, and we're very much looking forward to hearing from them. Again, everything is going to be recorded. We will use multiple platforms following today's presentation to get the word out, so to speak. At the end of the day, we will finish off with that role of education and training and how we take steps to ensure the workforce is better prepared.